This van doesn't just deliver, it's a care package on wheels. Jude Lewis used to drive school buses. Now he steers the Family Van, a free Boston-based mobile health clinic.
10 years ago, I came to the van as a client, and I saw how they were welcoming me, and I said to myself, if any opportunity comes, I have to work on this van.
Lewis is one of several community health workers on board. Mary Catherine Fallon is acting co-director.
It's generally preventive health services, blood pressure, blood sugar, BMI, pregnancy tests, anxiety, and depression screenings.
I think that should be all over the city. I really appreciate everything that they've done.
You're all set. Have a nice day, okay?
The Family Van was founded in 1992 by Dr. Nancy Oriel, an obstetric anesthesiologist and a former dean of students at Harvard Medical School. She noticed stark health disparities between well-resourced and underserved neighborhoods in Boston.
The important barriers we overcome are all about, knowledge, insecurity, finding someone to trust that you can talk to, having the freedom to ask questions.
Throughout the week, the van parks in Roxbury, East Boston, Mattapan, and here in Codman Square, Dorchester.
This is going to really help you to see where you're at.
Every service it provides is free, no appointment or insurance needed. Amidst a nationwide primary care shortage, the nonprofit Family Van is more important than ever, says acting co-director Raynell Walker-White.
We come into the communities that we serve. We meet the people where they're at. We're in their backyard. And a lot of times people are afraid to go into the doctors or hospitals because they can't afford the copay or the insurance.
Apollo Catala says the team here helps him keep on top of his health and out of the hospital.
Diagnosed pre-diabetic. My father had diabetes and he passed because of complications related to that.
You want to check it? Okay.
Interns and volunteers assist too, from medical students to undergrads, including Julia Churchford of MIT.
By providing a space that's present and accessible and free of socioeconomic barriers, people can feel like they have the opportunity to be empowered over their own health and have the opportunity to take care of themselves.
In the 34 years we've been out, it's close to 80,000 clients, and we've also trained about 1,200 students, so it's really impactful.
For Lewis, every route is a reminder of why he wanted this job in the first place.
When you know the purpose of taking the van to the site, that's why I'm excited to take the van out every day. That's a beautiful opportunity I have. I think that's what I want to do for the rest of my life.